Hello everyone, in this video we are going to see about radius. The radius is the lateral bone of the forearm. Anatomical position and side determination of the radius. To determine the side of radius, the following points should be noted. The narrow disc-shaped head is directed upwards. The lower end is expanded. The sharpest border of the shaft of the radius is kept medially. The styloid process of the radius is directed laterally and prominent tubercle is present at the lower end of the radius and it faces dorsally. Parts and features of the radius. Radius consists of upper end, shaft and lower end. Upper end. The upper end of the radius consists of the head, neck and radial tuberosity. Head of the radius. The head is disc-shaped and has a concave superior surface which articulates with the capitulum of the humerus to form humero-radial articulation. Neck of the radius. Constricted part below the head is called as neck. Radial tuberosity. Radial tuberosity of the radius lies just below the anteromedial part of the neck. It has a rough posterior part and smooth anterior part. Shaft of the radius. Shaft of the radius extends between the upper end and lower end. Shaft of the radius presents lateral convexity. It consists of three borders: anterior, posterior and medial or interosseous borders. And three surfaces: anterior, posterior and lateral surfaces. Anterior border of the radius extends from the anterior margin of the radial tuberosity to down close to the styloid process. It is oblique in the upper half and vertical in the lower half of the shaft of the radius. Posterior border of the radius is a mirror image of the anterior border, but clearly defined only in its middle 1/3 of the shaft. Medial or interosseous border is the sharpest border. It extends from the radial tuberosity above to the post margin of the ulnar notch below. Surfaces. Anterior surface of the radius lies between anterior and interosseous borders. Nutrient foramen is present in the middle of the anterior surface. Posterior surface. Posterior surface of the radius lies between the posterior and interosseous borders. Lateral surface. Lateral surface of the radius lies between anterior and posterior borders. Lower end of the radius. Lower end of the radius is the widest part of the bone. And it consists of 5 surfaces: anterior, posterior, medial, lateral and inferior surfaces. Anterior surface of the lower end of the radius consists of thick prominent ridge. Posterior surface of the lower end of the radius consists of 4 grooves for extensor tendons. Dorsal tubercle of the Lister lies lateral to an oblique groove. Medial surface of the lower end of the radius is occupied by the ulnar notch for the articulation of the head of the ulna to form inferior radioulnar joint. Lateral surface of the lower end of the radius is prolonged downwards to form the styloid process. Inferior surface of the lower end of the radius bears a triangular area for scaphoid bone and a medial quadrangular area for the lunate bone. This surface takes part in forming wrist joint.